All right. New guidelines issued this month by the World Health Organization. Now, this is the same organization that, as I mentioned earlier, was giving cover to the Chinese Communist Party when they sat on their hands when the coronavirus was beginning to spread. They didn't warn the rest of the world. Well, now they've come out with a 210-page document, guidelines, that are suggesting, or not actually suggesting, but really demanding that laws and other regulations that prohibit abortion based on gestational age limits be eliminated by all countries. This is, joining me now to talk more about this and where this is going is Mary Szoch. Mary is the director of FRC Center for Human Dignity. Mary, welcome back to the program.
Thanks so much for having me on, Tony.
All right, this document by the World Health Organization is to me, is stunning. That they are coming out and essentially saying that any jurisdiction that would try to limit abortion is violating human rights.
It is stunning, Tony, and it's not in line where the rest of the world is in their view of protecting life in the womb. Family Research Council recently released the World Report comparing the U.S. abortion laws to laws around the country protecting unborn life. And what we found is that over 50% of countries across the world protect life in the womb in all cases, or in all cases except for specific exceptions like rape, incest, and fetal anomaly, which of course we want unborn children to be completely protected. But what that tells us is that over 50% of countries are actually protecting unborn children, and only 3% of countries allow the kind of tragedy, the exploitation of the unborn child in the womb, the destruction of life, in the same manner as the World Health Organization is promoting. And those countries, of course, include North Korea, China, and the United States.
Mary, on page 28 of the guidelines, it says, quote, while methods of abortion may vary by gestational age, pregnancy can safely be ended regardless of gestational age. Gestational age limits are not evidence-based. They restrict when lawful abortions may be provided by any method, end quote. This seems to be running counter to the testimony before the United States Supreme Court in the recent Dobbs case that we're anticipating a decision on.
It absolutely is. But in one sense, Tony, the World Health Organization got it right. Gestational age limits don't make sense when we're talking about whether or not an unborn child dies. But unfortunately, that's not what the World Health Organization was referring to. They were talking about gestational age limits not mattering for the mother. And that's just false. We know that early second trimester abortions have a 15 times higher mortality rate than early abortions. We know that abortions after the point of viability have a 76 times greater mortality rate than early abortions. So what the World Health Organization is promoting is abortions that will result in not just the death of an unborn child, but the death of many more mothers as well.
Also, on page 28, I want to quote again from the report. It says, international human rights laws requires, and let me underscore that, international human rights laws requires that quality of care be central to the provision and regulation of sexual reproductive health. And thus, that regulation of abortion is evidence-based, scientifically and medically appropriate, and up to date. Well, as you just pointed out, science is making it very clear that abortion is harmful to women. But yet it's like everything else that we're seeing from the left. They sweep the inconvenient science under the rug.
They absolutely are. And this isn't even in line with what people in America want. You know, this is really the far left extremist view. You know, people in America, we see that over 50% of Americans actually are supportive of protecting an unborn child in the womb after his heart is beating. And this is demanding that countries who value life change their laws to accept abortion on demand until the birth of the child.
So Mary, how will this be used? I mean, this is coming from an agency of the United Nations. It is, basically a declarative document saying that these countries should change their laws lest they be found as violating human rights. How might this be used by the left?
Well, we've seen in countries throughout the world who have laws protecting life, we've seen organizations like Marie Stopes International, like Planned Parenthood International, point to the World Health Organization as a standard of care. And we've also seen these organizations come into countries who actually need maternal health care. And they have said, we'll provide maternal health care for your people, but included in that has to be access to abortion.
Right.
Well, this idea it's just false that this is actual health care.
Yeah, I think our State Department under the present administration would use this to twist the arms of these various governments and even linking our foreign funding to these types of policies, even though they're not U.S. policies, they're UN policies. Mary Szoch, thank you so much for joining us. Always great to talk with you. You're on top of all these issues, and it's always good to hear from you.
Thanks so much for having me, Tony.